I think going through orthopedic surgery, something that really attracted me was the ability to make a big difference in someone's life. And hip and knee replacements are among the sort of highest satisfaction surgeries that we do. And hearing patient stories about losing some quality of life and then being able to provide an intervention that really gives them that function and quality back was really a rewarding opportunity for me. My patients are three groups. The first group of patients are patients who have hip or knee trouble and are seeing a doctor for the first time. And for those people, I really try to take the time to listen to them and hear their story, because everyone's got a different journey in that sort of process. And for those patients, if I'm the first one seeing them, surgery may not be the answer. And we have tremendous resources here, physical therapy or medical treatments, and being able to plug them into those resources often provides them, based on the story they're telling me, what they need to get back to what they'd like to do. A large group of patients, or a second camp, are patients who have had hip or knee trouble for quite a while. And so I take the amount of time to go through the process of talking about surgery and what that entails with those patients. And then the third group of patients I see are patients who have had a hip or knee done somewhere else and have run into trouble. And so those are patients that are a little bit more complex. I actually love my time in clinic. I don't feel pressure to move really quickly or rush patients in and out. I really like to sit down and pull up x-rays and go through them. I frequently am bringing models into the room, of hips and knees to make sure that, everyone understands exactly what we're talking about. I'm a Northeast Ohio native, and I made the decision to come back here because I want to treat and care for the patients in the community I grew up in. And that makes this sort of rewarding process of helping folks even more so for me.